Manual assisted cough is a technique used to enhance cough strength. It can be carried out in a sitting or lying position. The pressure is applied on the abdomen. For safety, ensure that the patient is well supported. If the patient is sitting in a wheelchair, ensure that the wheels are locked. There are two techniques for self-manual assisted cough. Technique 1. Sit up in the chair. Place both hands on your abdomen, between the belly button and the lower tip of your breastbone. Take in a deep breath. Apply pressure in an inwards and upwards movement as you cough. Technique 2. Sit up in the chair. Hold around your knees or thighs. Take in a deep breath. Pull your knees up towards your chest and lean forward as you cough. An assistant is needed if the patient is unable to do manual assisted cough independently. The patient and assistant will need to coordinate with one another for effective assisted cough. This can be done in a sitting or lying position. Assisted cough in sitting position. Sit the patient in a chair with head and body well supported, preferably against the wall. If the patient is sitting in a wheelchair, ensure that the wheelchair is locked. Facing the patient, lower yourself such that your arms are in front of patient's abdomen. You can either bend your knees slightly as though you are in a semi-squat position or kneel on one knee. Place both your thumbs together and spread your fingers wide apart, forming what looks like a butterfly. Put the heel of your hands midway between the belly button and the lower tip of the breastbone. Instruct the patient to take in a deep breath and cough.
Take a deep breath and cough. Again.
Apply pressure in an inwards and upwards movement as the patient coughs. Repeat the process until secretions are cleared. If required, you can perform suctioning to remove the secretions. Assisted cough in lying position. Ensure that the patient is lying on a flat surface. Technique 1. Place your hands in the same butterfly position used in assisted cough in sitting position. Apply pressure in an inwards and upwards movement as the patient coughs.
And cough.
Technique 2. With your arms forward and elbows slightly flexed, place one hand on top of the other on the patient's abdomen between the belly button and the lower tip of the breastbone. Apply pressure in an inwards and upwards movement as the patient coughs.
Taking a deep breath and cough.
Technique 3. Place both forearms firmly across the patient's abdomen, horizontally below the ribcage and above the belly button. Apply pressure in a downward direction as the patient coughs.
Taking a deep breath and cough.
Breath stacking is a technique used to improve peak cough flow by inflating the lungs with as much air as physically possible. It is also called lung volume recruitment. Breath stacking can be done to expand the lung, improve cough effectiveness and secretion clearance, increase speech volume. For safety, ensure that the patient is well supported. If the patient is sitting in a wheelchair, ensure that the wheels are locked. To perform breath stacking on your own, connect the ambule bag to the one-way valve with the arrow facing you. The one-way valve should only be used during breath stacking. Do not use it during rescue breathing. Connect the mouthpiece after the one-way valve. Use a face mask if it is difficult to seal your lips. Seal your lips tightly around the mouthpiece. You can use nose clips to prevent air leakage from your nose. Take in a deep breath as you gently squeeze the ambule bag. Hold your breath and stack another breath in. Stack 3 to 5 breaths until your lungs are full. You may feel a gentle stretch in the chest. Take the mouthpiece out and cough. If it is difficult to squeeze the ambu bag, you may put the ambu bag under your armpit, in between your legs, or even under your feet. An assistant is needed if the patient is unable to do breath stacking independently. The patient and assistant will need to coordinate with one another for effective breath stacking. This video will demonstrate breath stacking using a face mask. Ensure that the patient is sitting on a chair with head and body well supported. If the patient is sitting in a wheelchair, ensure that the wheelchair is locked. Apply face mask firmly, covering nose and mouth. Support the back of patient's head if needed. Ask the patient to take in a deep breath as the assistant gently squeezes the ambu bag when the patient breathes. Ask the patient to hold the breath and stack another breath. Stack 3 to 5 breaths until the patient's lungs are full.
Breath in, and cough.
Wash mask and mouthpiece with mild detergent and air dry before keeping. Thank you for watching. For more information, contact HVRSS or speak to your doctor today.